silence doesn't always mean safety, especially when it comes to men's health. Prostate cancer is a stealthy predator that strikes elderly men without warning, claiming lives swiftly. Each year, thousands of men discover this disease too late, turning a potentially treatable diagnosis into an almost fatal sentence. Do you want to know how to recognize the signs before it's too late? In this content, we will reveal the hidden symptoms that could save your life or that of a loved one. More than just information, this is a survival guide that can completely change your perspective on men's health, showing that knowledge is literally the best medicine against this silent threat. The reality of late-stage prostate cancer diagnoses is a silent nightmare that haunts thousands of elderly men. Many only discover the disease when it has already significantly advanced, drastically reducing the chances of successful treatment. It's like an imperceptible time bomb that may be developing without any visible signs. Early recognition of symptoms completely transforms the prognosis. Imagine having the ability to identify the first signs before the disease spreads. This could mean the difference between a winnable battle and an almost impossible fight against cancer. Specialist doctors emphasize that early detection increases the chances of treatment and cure by up to 90%. It's astonishing how small changes in the body can be crucial indicators of something more serious. Men need to be vigilant and break the taboo of silence surrounding their own health. One of the main challenges is that many men ignore the early signs, considering them a natural part of aging. This is a dangerous mistake. Every symptom should be investigated. Every discomfort deserves medical attention. The prostate, a vital organ in the male reproductive system, requires special care, especially after the age of 50. The human body always sends signals, but we don't always know how to interpret them. Changes in urinary habits are often the first warnings. Difficulty starting or maintaining a steady urine stream, increased frequency during the night, a feeling of incomplete bladder emptying. All of these can be a silent cry for attention. Pelvic pain, discomfort while sitting or during daily activities should also not be ignored. Many men downplay these symptoms, attributing them to stress or the natural aging process. However, each sign can be an important warning. The presence of blood in the urine or changes in colour and consistency are already red flags that require immediate evaluation. There is no room for shame or fear when it comes to health. Unexplained erectile dysfunction can also be a significant indicator of prostate issues. The main guidance is simple: don't wait. See a urologist regularly, get preventive exams like a digital rectal exam and PSA test, and pay attention to changes in your body. Life deserves to be celebrated, and for that, we need to take care of our health with responsibility and courage. The prostate is an organ of the male reproductive system, located just below the bladder, roughly the size of a walnut. Its primary function is to produce a fluid that nourishes and protects sperm, making it essential for fertility. As men age, this gland begins to undergo significant changes. Natural growth and hormonal shifts make men more vulnerable to developing issues, especially cancer. Age is a critical factor. After 50, the risk increases significantly. The development of prostate cancer is closely linked to genetic, hormonal, and environmental factors. Prostate cells begin to multiply uncontrollably, forming tumours that can remain silent for years. It's like a stealthy invader that gradually takes over territory without giving a single warning. Older men are particularly vulnerable for specific reasons. Hormonal changes, a weakened immune system, and years of exposure to risk factors contribute to this increased susceptibility. Unlike other diseases, prostate cancer doesn't discriminate. It can affect seemingly healthy men as well as those with more complex medical histories. The cellular transformation that leads to cancer is a gradual and complex process. Genetic mutations begin to alter the normal behaviour of cells, causing them to lose the ability to self-regulate. It's as if a group of cells decides to take a completely different path, ignoring all the rules of normal bodily function. Risk factors such as family history, ethnicity, obesity, and a sedentary lifestyle significantly increase the chances of development. Men with close relatives who have had prostate cancer need to be even more vigilant, as genetic predisposition can be a determining factor. It's important to debunk the misconception that prostate cancer is a death sentence. With early diagnosis and proper treatment, the chances of a cure are extremely high. Modern medicine offers various resources to combat this disease, ranging from minimally invasive surgeries to more advanced treatments. The key lies in prevention, regular monitoring, and awareness. Every man needs to take charge of his own health, breaking taboos and overcoming the fear of undergoing preventive exams. The early warning signs of prostate cancer often begin with urinary difficulties that go unnoticed. Imagine waking up several times during the night needing to use the bathroom, or feeling that your urine stream isn't as strong as it used to be. These changes aren't just common annoyances of aging, they could be important warnings. Men over 50 need to pay attention to changes in their urinary patterns. A critical sign is the frequent need to urinate, especially at night, disrupting sleep and causing fatigue. The urinary stream may become weaker, hesitant or fragmented, requiring more effort to start urinating. Some men report a feeling of incomplete bladder emptying, as if something always remains. This condition should not be ignored. Delays in starting urination, dribbling after finishing, or a thinner stream are signs that warrant immediate medical attention. Nocturnal urinary frequency can mean much more than mere discomfort. When the number of trips to the bathroom increases significantly during the night, it may indicate changes in the prostate that need to be investigated. It is crucial to understand that these changes do not automatically mean cancer, but they represent an important warning. Many men tend to downplay these symptoms, considering them a natural part of aging. However, science shows that every change deserves careful investigation. Specialist doctors recommend that any persistent change in urinary patterns be evaluated by a professional. Simple tests such as a digital rectal exam and PSA level measurement can provide crucial information about prostate health. The key lies in attentive observation and the courage to seek medical help. Do not feel ashamed or afraid to undergo preventive exams. Your health is more important than any prejudice or momentary fear. Remember, the prostate doesn't give a warning when it starts to develop issues. Being proactive can make all the difference between an early diagnosis and a more complex battle against the disease. Pain or discomfort in the pelvic region is not something that should go unnoticed. Many men ignore this symptom, thinking it's just fatigue or the result of physical exertion. But the truth is, this sensation could be a silent cry from your body asking for attention. Imagine an uncomfortable pressure every time you sit, as if something is pressing on your intimate area. This discomfort is not normal and deserves investigation. Some people describe it as a feeling of heaviness or a constant pressure that seems to have no clear origin. During everyday activities, this discomfort can manifest in different ways. While driving, sitting for long periods, exercising, or even doing household chores, the feeling of discomfort may intensify. It's as if your body is sending warning, signals that cannot be ignored. Doctors warn that this pain can vary in intensity. Some men report a mild, almost imperceptible twinge, while others experience more intense discomfort. The variation does not mean the problem is less serious. On the contrary, each manifestation deserves careful attention. What's interesting is that this pain can appear intermittently. It's not always constant, which leads many men to think it's nothing serious. But this irregularity does not diminish the importance of the symptom. Each episode of pain is like a warning signal from your body. The pelvic region is complex, and any change can indicate different health conditions. In the case of prostate cancer, this pain could be a sign that something isn't functioning properly. It does not necessarily mean a definitive diagnosis, but it certainly calls for a thorough investigation. Experts recommend that any man experiencing this type of discomfort should not ignore it. The natural tendency is to downplay the symptoms, attributing them to stress or the natural aging process. But health should not be treated with neglect. The courage to investigate is the first step toward an early diagnosis. Do not be afraid to speak openly with a doctor, share your concerns, and undergo the necessary tests. Your life deserves attention and care. The presence of blood in urine is a frightening symptom and should not be ignored or downplayed. When urine appears discoloured, with reddish or pinkish tones, It represents a red flag that requires immediate attention. The presence of blood, scientifically called hematuria, may seem extremely alarming. Many men are paralyzed with fear upon noticing this change, but it is important to stay calm and seek medical evaluation promptly. It does not always mean cancer, but it certainly indicates that something is not functioning correctly in the urinary system. Changes in the color and consistency of urine can present various aspects. In addition to visible blood, the urine may appear darker or have nuances different from the usual. Some men report urine that appears cloudy or contains small clot, signs that should not be ignored. These changes can be associated with various conditions, ranging from urinary tract infections to prostate tumours. The cause may be multiple, but the important thing is to investigate promptly. Medical specialists emphasise that the earlier the diagnosis, the greater the chances of effective treatment. The bleeding may be continuous or intermittent, which does not lessen its severity. Some men experience single episodes and believe it has passed, but this false sense of security can be dangerous. Each occurrence deserves attention and professional follow-up. Factors such as advanced age, family history, and a sedentary lifestyle increase the risks. The likelihood of prostate problems rises significantly after the age of 50, making constant vigilance essential. Experts recommend not feeling ashamed or afraid to seek medical help. Many men avoid getting tests due to embarrassment or fear of the diagnosis, but this behaviour can turn a simple issue into a serious condition. Additional tests such as ultrasound, CT scans, and MRI can provide accurate information about what is happening. Modern technology allows for increasingly faster and more precise diagnoses. The main message is clear: pay attention to the signals from your body. Blood in the urine is not normal under any circumstances and warrants immediate investigation. Your health is too precious to be ignored. Let's talk about a warning sign that many men prefer to ignore: erectile dysfunction. This condition is not just a sexual performance issue, but can be an important indicator of more serious prostate problems. When the ability to maintain an erection becomes inconsistent or simply disappears, it cannot be seen as normal or just part of aging. Unexplained erectile dysfunction may be a sign that something more is happening in the body. Imagine the frustration of realizing that something has significantly changed in your sexual life. This change is not just a physical issue, but can deeply affect a man's self-esteem and emotional well-being. The shift in sexual performance can be a silent cry from the body asking for attention. Scientific research shows a strong connection between erection problems and potential changes in the prostate. When the blood vessels and nerves responsible for sexual function are affected, erectile dysfunction can appear as an initial symptom of more complex issues. It's not about shame or something to be hidden. Many men feel embarrassed to talk about this topic, but silence can be more dangerous than any momentary discomfort. The courage to seek medical help can make all the difference. The factors contributing to this condition are multiple: hormonal changes, circulatory issues, stress, and of course, possible prostate alterations can be responsible. Each case is unique and deserves careful and personalised investigation. Specialist doctors recommend that any significant change in sexual performance be investigated. Tests such as hormonal levels, prostate evaluation, and consultations with a urologist can provide important answers. Modern medical technology offers various treatment options. From medications to more advanced therapies, there are multiple alternatives to address erectile dysfunction and potential prostate issues. The secret lies in attention and care. Do not ignore the signs from your body. Every change can be an important alert. Your sexual and overall health deserves all the attention and care possible. Be courageous, seek help, and stay informed. A healthy sex life does not end with age. With the right care and proper medical follow-up, it is possible to maintain quality of life and well-being at every stage of existence. Practical guidelines for early detection of prostate cancer need to be clear and straightforward. Every man over the age of 50 should understand exactly when to seek medical help and which tests are essential for diagnosing potential abnormalities. The first recommendation from specialists is to undergo regular urological checkups, preferably once a year. Even without apparent symptoms, this consultation can reveal important details about prostate health. Doctors emphasize that prevention is always the best approach. Essential tests include the digital rectal exam and the PSA, prostate-specific antigen test. The digital rectal exam allows the doctor to directly assess the size, texture, and any potential changes in the prostate. Many men feel apprehensive about this procedure, but it is quick, painless, and can save lives. The PSA test analyzes a specific protein in the blood that may indicate prostate issues. Elevated levels do not necessarily mean cancer, but they serve as an important indicator for further investigation. Accurate interpretation must be done by a professional, taking into account age, family history, and other factors. Some signs that require immediate evaluation include persistent urinary difficulties, pelvic pain, blood in the urine, or changes in sexual performance. Any of these symptoms warrant prompt medical attention, regardless of age. Men with a family history of prostate cancer need to be even more vigilant. Genetics can significantly increase the risk, making regular monitoring essential. Some experts recommend starting preventive screenings even earlier in these cases. The frequency of checkups may vary depending on the individual profile. Men between 50 and 70 years old generally need annual evaluations. After 70, the decision should be individualized, taking into account specific health conditions. There is no room for shame or fear when it comes to health. Every man needs to take charge of his own well-being, breaking taboos and overcoming prejudices. A simple exam can make all the difference between early treatment and a complex battle against the disease. Taking care of prostate health is not a luxury, it's a necessity. After explaining all the warning signs, we need to emphasize that knowledge saves lives. The symptoms we experience are not just information, they are true guardians of your existence. Prostate cancer can be silent, but you don't have to be passive. Every man has the power to change his story through prevention. Getting regular checkups, paying attention to changes in the body, and seeking medical help are actions that make a world of difference. Breaking the taboo of male silence about health is essential. Don't be ashamed, don't downplay symptoms, don't postpone appointments. Your body deserves respect and care. The courage to face fears can mean years of life and quality. Share this knowledge with friends, family, partners. Every piece of information can be a trigger to save a life. Prevention doesn't choose age, it chooses awareness. Take care of yourself, observe yourself, and be the protagonist of your health.